Hello again, everyone. It's Melissa, and I'm back to talk to you today about the price of healthcare. Are we helping or hurting people? Did you know that the cost of healthcare has increased from $714 billion in 1990 to $2.2 trillion in 2008, and that the majority of this cost comes from medical procedures and tests? A simple blood test to check your complete blood cell count, also known as a CBC, can range anywhere from $11.02 if you have Medicare, because that's what they'll reimburse for it, to $157.61 or more if you're paying out of pocket. This price is also only for just one test. A trip to the emergency department can wind up costing you thousands, as you're potentially charged for multiple blood tests, X-rays, CAT scans, doctor's exams, as well as the cost of the facility itself. So why does the rising cost of healthcare matter to me, you might ask? Well, at one point or another, you or someone that you know will be a participant in the healthcare system, potentially even the emergency department. From strains and sprains, lacerations, coughs and colds, wellness checkups, or serious illness or injury, everyone needs healthcare. It just depends on how much you're going to pay for it, for those tests and procedures when you get them. A second point arises when healthcare costs are discussed, and that is, are all these expensive tests really necessary? I have worked in various emergency departments for the past 8 years, and I can tell you with 100% certainty that the answer to this question is no. There are many tests that are performed, especially in the emergency department, that are not medically necessary. Why are these tests done? Well, in the litigious society we live in, physicians are afraid of a lawsuit. It's called defensive medicine. In an article by Stephen Brill, one physician commented, "We can't get sued for doing too much." So in this presentation, I will show that just in case I get sued, medical tests performed in the emergency department are a large contributor to the increase in healthcare costs. How much will these tests cost me anyway? Well, if you ask this question as I did in the emergency department where I work, you would be surprised by the answer that you would get. When I was gathering information for this presentation, I asked one of the registration personnel if there was a charge list to show patients what certain tests cost them. She said, "We don't know." I replied, "What do you mean, we don't know?" She said, "Well, we don't know what the physicians are going to charge, so we can't tell the patient what their bill is going to be." With a puzzled look on my face, I said, "But there has to be something that says what the hospital will charge for certain lab tests or x-rays." She then pointed to a binder where the list was kept. And here's a copy of the list right here. I'm now going to give you a rough estimate of a hospital bill if you go to the emergency department for abdominal pain. Blood tests will be done to include that CBC. At this facility, they'll only charge you $64. A complete metabolic count that looks at your electrolytes, that's $70.50. A urinalysis, that's $32. If you're female, that you'll also get a urine pregnancy test, that is $63. Usually a CAT scan of your abdomen with contrast, and that's $1,675 for a whopping total of $1,904.50, and that is just for testing. That does not include the physician that saw you or the hospital charge for you to be actually treated at that facility. You can imagine how devastating this must be for people that do not have insurance. But does having insurance mean you'll be charged less? Not necessarily. In a study done by Nolan Caldwell et al. Entitled, "How Much Will I Get Charged for This? Patient Charges for the Top 10 Diagnoses in the Emergency Department," it found that Medicaid patients were actually charged the most overall, with a median of $1,305, followed by private insurance at $1,245, and then uninsured patients actually got charged the least, and that was $1,178. With the average cost of a visit to the emergency department exceeding what most people pay each month in rent, it's not hard to believe that in less than 2 decades, healthcare costs have risen by almost $1.5 trillion. That is a lot of money. To illustrate my second point about the necessity of these medical tests, we're now going to discuss a study done at Children's Memorial Hospital in Chicago. This study looked at a physician's likelihood of ordering a specific, sometimes expensive test when they were aware of how much the test actually cost. The study found that there was a significant decrease, 50% decrease actually, in chest x-rays that were ordered, just as an example, in the tests ordered when the physician knew the cost of the test. But what about practicing defensive medicine? Even though physicians know the cost of a test, aren't they still afraid of being sued? According to the American College of Emergency Physicians 2011 survey, 44.4% of emergency department physicians chose fear of lawsuits as the #1 answer to the question about the biggest challenge to cutting emergency department costs. Over half of those physicians, 53.5%, also gave a fear of lawsuits as the main reason for conducting so many tests. In conclusion, I have showed you today through several examples that the cost of healthcare is expensive, that all these expensive tests are not medically necessary, and that it's the fear of lawsuits that drives much of this testing. I am hopeful that after my presentation, you have a better grasp on the actual cost of medical tests and procedures, and with what you've learned today, I urge you to question hospitals and physicians about the necessity of medical testing and the costs that actually can come with them. Thank you so much. I hope you learned a lot. Bye-bye.